Hi, good day, and welcome to the Microdose Diet podcast. Today, you have a treat because you're going to be able to listen to Dr. Suzanne for the next 25 minutes. So, just to make a quick intro in case you're not familiar, and you should be with Dr. Suzanne, she's a prominent physician and she really specializes in obstetrics and gynecology. And she has a very strong focus on women's health and integrative medicine. She wrote a fabulous book that I recommend, highly recommend, that is called Menopause Bootcamp. She's going to tell us more about her experience as a professional with menopause and how psychedelics might play with that. And my name is Peggy Van de Plassche. If we've been watching and listening, you know what we're talking about here. We're talking about all things personal transformation and psychedelics. So, Dr. Suzanne, thank you so much for being with us today. How are you doing?
I'm great. Thanks for having me, Peggy. I'm excited
Oh,
to have this conversation.
yeah, that's fabulous. And we've been very lucky because we've already had a conversation on a topic pretty similar on a panel last month, and it was extremely well received. So
Yeah.
we're doing it again, you know.
Yes, yes.
So let's get going because I really want to have more of your perspective on women's health and wellness. So have you seen the landscape of psychedelics in healthcare evolve, and
Yeah.
especially again for women's health and wellness?
Yeah. I mean, it's very cutting edge. I think what's happening is that there's just this conversation that has really um, evolved and emerged, especially in the last probably 5 years, a little more publicly. I mean, obviously, psychedelics in the medical world have been going on since people started really studying this stuff in the 50s and 60s and 70s. It kind of went underground. I think with the emergence, honestly, of cannabis and cannabis legalization growing, people are much more open to talking about other forms of psychoactive medications and
Mhm.
plants. These plants are really powerful. Whenever you start talking about mental health, I think we're going to be talking about everybody's health. And I think that the mental health world and the openness in the mental health world has really helped people look at women's health, quote, issues. I mean, that's a pretty broad topic, but
Mhm.
for a variety of reasons, we're seeing a lot of conversation. Now, in terms of the medical world, specifically around psychedelics and women's health, I really think we're just starting to scratch the surface. I don't think it's very obvious. I think because in the United States and elsewhere in the world, because there's so little access to regulated substances, and there's a whole conversation around that too. It becomes more of an underground conversation. But here's where I've seen it in my practice and in my community. I'm in Los Angeles. I'm in West Los Angeles specifically. You know, California obviously is known for being very progressive, very
Yeah.
open-minded, very cutting edge. Um, so some of that is definitely being influenced. You know, the conversation around psychedelics and women's health is definitely being influenced. I think the conversation around all women's health topics has really exploded during the time that I've been in practice in 25 years. So everything from sexual health to pregnancy normalization to breastfeeding to birth options. And now we're moving into sort of midlife changes, perimenopause and menopause. And so for these reasons, especially that, we see a lot of changes in people's body image and their experience in their body in, quite frankly, that midlife transformation. Like, who am I going to be for the rest of my life? This is not like I'm done. You know, the average life expectancy for women in North America is, you know, late 70s, early 80s. So we're not dying around the time of menopause. We got another 30 years to go. And there are a lot of mental health challenges that face us as a result of both societal pressures and just the experience of perimenopause and menopause, the hot flashes, the sleep disturbance. There are hormonal shifts that have a definite impact on mood, and we see so many women end up on antidepressants. When I'm not here to say antidepressants are bad, they're a tool. But if it's the only tool you have in the toolkit, you don't realize there are other tools in there. then we have a problem. And I think 1 in 4 women in North America, I don't know if that is just North America or the United States, so I don't want to quote, but 1 in 4 around this time wind up on antidepressants. That's a really huge number. And the numbers of women who start having a recurrence of earlier mood disorders or new onset of mood disorders, is a lot of times anxiety, depression, panic, are enormous. And this is, I think, where we can easily make that transition from psychedelics to women's health, because the data, the really strong data on psychedelics, specifically with mental health and addiction, are really important. And I think they're making people stop and look at, well, if I'm 45 and now my premenstrual symptoms are worsening, is microdosing an option for me? I mean, just to be quite frank, and I have a lot of patients coming in asking me about this or doing it. And then in menopause and in our older years, we know that anxiety and depression and loneliness are epidemic. And are these tools that we can be using? I think the other areas that are interesting to me are looking at dementia, brain changes, cognitive changes, perceptual changes, neuroplasticity. There's some really interesting data that seems to indicate that some psychedelics are really working in why it's working is because of neuroplasticity, right? Yeah. We know the BDNF, changes. We know that we get neural growth, neural connections, new neurons being produced when people use, for instance, psilocybin. So is this another area that we can or should be looking at for dementia, which affects, I think, like 1 in 6 older adults and 1 in 2 to 3 women as we head into our older years. So these are huge numbers of people affected. Is this natural solution an option? I mean, I think yes. We don't have the science to say that yet, but I think these are all very promising areas for us to be looking at. Are the conversations starting to happen? Look, often with these kinds of things, it's going to come from the community, from grassroots mobilization, maybe before it will come from the science community. But that's a viable way to move forward.
Exactly. And I remember our last conversations, you made a very interesting point that I never thought about in the past, the lack of studies proper to women's health. You were mentioning the impact of estrogen on the brain.
Yeah.
Things that are just being researched now.
Yeah.
It makes it a bit more challenging to have specific insights on women. I think the past view was, well, men equal women or women equal men. Well,
it's not true. It's not true.
So by default, women were not researched. So I thought that was such an enlightening point when you mentioned that. Do you want to expand a little bit on that?
Well, I think for the people who are listening and following along, especially people who have been are coming at this from the world of psychedelics, I want them to understand exactly what you said, which is that a lot of the data that we have on anything that you're looking at, any Tylenol to, antibiotics, haven't been studied thoroughly in women. Okay, so in 1993, the FDA required that clinical trials include women in the United States. Okay, that's how we decide if a drug is doing what it says it's going to do, is safe and effective. That's while I was in medical school. That means that anything that came to FDA and got approved up until 1993 wasn't specifically studied in women. And to assume that women are small men is wrong. And our physiology, specifically around, hormones, are differing levels of hormones, because we all men, and estrogen isn't a female hormone, testosterone is not a male hormone. That's inaccurate, but we experience these hormones differently. We cycle, things like that. And then you kind of realize, okay, well, psychedelics are having this big impact on the brain. And what I shared at the conference we were at was that not until mid-June this year, 2024, did we even have any data of any significance on how estrogen acts in the brain before and after menopause. Lisa Mosconi just published in the journal Nature on, I think, June 17th. So I think when I saw you, that data had not even been published yet.
So, yeah.
in Toronto. That is 1994. And the story behind that is that in 2018 or 19, when she wanted to start looking at, wait, why is Alzheimer's so much more common in women? Is it related, in older women, is it related to estrogen changes, which I think, people kind of presumed. There was no way to even trace estrogen receptor activity in the brain. She had to first invent that technology and then do the study. That's crazy. So what I'm trying to say is, like, if you're reading data on like psychedelics doing XYZ, is it studied in women? Probably not. Do women's hormonal fluctuations while they're cycling, when you're on birth control, when you're off birth control, when you're in perimenopause, when you're post, do they have an influence on your brain? Of course they do. We know they do. So we have to be careful about making assumptions and generalizing from, rat models in the lab, which are almost always male rats, by the way, almost always, to, human females. I think we can look at the basic science and use those as foundations, but people need to be very, very cognizant, especially female people, about what does this really mean for them and their experience. And I think one of the reasons that I've been so excited about working with Ashley Walsh and Interstate is that they are doing research, some of the only research on whole mushroom psilocybin in a DEA approved lab in the United States. There are 2 labs in the US where you can do this research because it is so heavily regulated. They're at one of them in Ohio State. And they have gone and they've pivoted their research mission because they started more in addiction and mental health. And they realized, what, women's health is really lacking. Yeah. So that is now the focus. So I think we're going to start to get some data on that coming in, which is very, very important and groundbreaking. This is 51% of the population. This is not niche.
It's interesting. I was having a drink yesterday with a girlfriend, and she's telling me she's been on antidepressant for like 20 or 25 years. And I have multiple girlfriends like that, 20, 25 years, antidepressant, anti-anxiety. And to your point, they were probably medication, but at the time were barely, using men and women, probably not,
right.
Because 25 years ago, it was probably older medication.
Right.
Everyone is very afraid to stop it because
of course,
what's going to happen. And then
right.
After 20, 25 years, you would hope that we're healing. And that's what I love with psychedelic. And you mentioned neuroplasticity.
Right.
As antidepressant, and they have a use. You're losing your family. You need that tool to help you to get up in the morning.
Right.
For 25 years, you hope that you would have something that would have brought you from here to there, which I think psychedelics, thanks to neuroplasticity, will be able to do. But I have not seen that so far with, and maybe it was an older mindset of managing symptoms.
Right.
Versus healing. So what?
Yes.
What do you think about that?
That's a really good point. And I mean, I want to say, like, also, I'm always very careful because obviously I'm educating here and expressing my opinion based on the evidence that I see in my own just personal experience of life. Neither of us are saying like, hey, get off, throw your Prozac out and start doing mushrooms. Obviously, no, we're not saying that. I mean, for a million reasons, but I agree with you. I think the science around a lot of the antidepressants, especially the serotonin reuptake inhibitors, I think everybody kind of got into this place of like, we're treating this like a disease, like diabetes, but I don't think the science is actually there. I think the mechanism of action on these drugs is there. We know how they work. They keep serotonin in the synapse longer, so you're not depleting it. Do we have data really, really proving that people have an organic disorder? We don't. We actually don't. Are they helping millions of people? Yes. I think we need to do better. And I think that's where you're right. It's like, we're going to inhibit the normal activity of the brain in order to help people have a better experience of their life. That's what these medications are. Thank God for them. They're helping people live their lives. I think it's a lot more complicated than that. I think people have unmanaged trauma. They're burnt out. They're not supported. I mean, our systems that we live in are not about human beings. They are about capital and moving capital. I mean, it's very complex. We feel very divided from ourselves, from our communities, from nature, from God, from spirit, whatever it is. These to me, I'm not blaming anybody for their depression, but I mean, it's hard to divide these things. Using psychedelics has a very different perspective. The perspective is, as you said, on integrating with the natural world, because especially I'm more interested in and more knowledgeable about mushrooms specifically, but other plant-based medicines. That is where my interest is in. And I specifically am working with a company that's doing whole mushroom research, because I'm not a fan of the conventional approach to pull the psilocybin out and amplify it and make it into the Tylenol of the psychedelic world. I'm not down with that, to be honest. That's not what plant medicine is about for me. It's about an experience of reintegrating with the natural world, and a healing experience, some of which is ineffable. We cannot understand all of it. Now, why is that? The brain is making its own new connections.
Exactly.
And it's kind of getting you out of, if you think about your groove in the record, and that groove gets really deep because you just are only playing that one song. How do you get to the, and it gets stuck, or you get a scratch in the record? How do you move to the next song? We're creating a new connection there. And that's not the best analogy in the world, but that's what came to me. So I think it's just a really different approach, and it takes a big mindset shift, which of course these medications or plants or whatever we want to call them, because they are medicines, they help you change the mindset. I mean, I just came back from a week-long retreat where I was teaching at a wisdom school called MEA, Modern Elder Academy. And what we know, there's plenty of science about how important growth mindset is, having a purpose, continuing to grow, flow state. All of these things are places where we challenge ourselves, get new skills, and sort of move forward and ahead into a new experience, a new vision of ourselves. We know from brain research and social science research that these things happen. I think psychedelics have a really interesting role to play in that.
I agree.
And there's plenty in the field of trauma and addiction already.
Yeah, I think, you mentioned trauma and this idea that depression is a chemical imbalance, while you never ask the people you prescribed it what happened in your life. Okay, let's give you some talk therapy, and here you go. I'm like, that's a bit light as an approach, which is also why we're seeing such a challenge with health. Before we finish that, I want you to tell us more about the Menopause Bootcamp, the book, but also the course. I know it's not psychedelics, but I think it's very interesting.
Well, but it's this, I feel like it's this, I'm the psychedelic, I'm the philosopher of the Menopausal. So for those of you who had not heard of the Menopausal, there's been this tremendous amount of momentum really in the field of midlife, women's health, and menopause. And there are a bunch of experts out there who all sort of work together behind the scenes. We are colleagues, we are collaborators, we share information, we promote information, and we actually have become friends. We call ourselves the Menopausal. And I really, when I look at everybody, we all have different, some of us are more skeletal and, weight management. Some are more cancer. Some are more like the data. Some are sex med. Some are musculoskeletal health. Some are psychiatrists. Some are cardiologists. I feel like I'm an OBGYN. I don't practice obstetrics anymore, but I am a board certified gynecologist. I'm also board certified in integrative and holistic medicine. And obviously from this podcast, you see that I'm very interested in kind of the combination between ancient wisdom and cutting edge science. That's sort of my sweet spot. So I'm sort of a philosopher. So Menopause Bootcamp sort of fits into this, because I think the kind of person who would be interested in both, the modern science and the ancient tradition would be attracted to this. I started working in this area because people didn't have enough knowledge or time, both doctor people and human people experiencing it, and they weren't getting the information. And so I knew I couldn't get the information to people to educate themselves, to advocate for themselves, to understand their experience, to understand the transition, to understand what is the toolkit, hormone therapy, medicines, plants, lifestyle, Ayurveda, which is my background in Indian medicine. And so I created an experience called Menopause Bootcamp to educate people, to empower them, because as I mentioned, with what I think is going to happen in the psychedelic world, what I've seen in women's health is that all the women's health paradigm shifts that I've seen in 25 years in women's health have really come from the community. They have not come top down. They're
Okay.
not coming from American College of OBGYN. Maybe it's different in Canada, but I don't think so.
No.
It's not coming from our board certification. They're not coming from our institutions. Those institutions are doing the best they can, but they are conservative by nature. They take a very long time to change. But when the community demands better care in the labor and delivery service, or that they can breastfeed publicly without shame or it being illegal,
Yeah.
then things change. I call it sort of the paper or plastic effect of medicine, right? Like when I was 25 years ago, you'd go into the supermarket, they'd ask you paper or plastic. They don't do that anymore. You bring your own damn bag.
Exactly.
That didn't happen because the grocery association was like, hey, this sounds like a good idea. No, the community was like, this is terrible for the planet. Why are we doing this? It's the same thing in women's health. So that's, I created this to help engage and create more grassroots mobilization. And I've seen it work. I wrote a book published by HarperCollins almost 2 years ago, which is crazy to me because in 2 years, I can't believe how the landscape has shifted. Everybody's talking about it now.
Yeah.
And I, from the beginning, realized that I wanted to create an opportunity for others to hold their own boot camps, both because I saw it as a grassroots effort, and also because it's inappropriate for me to come into your community and tell you how to do this. I have the template, I have the facts, I have the format, I have the experience. I'm going to teach you how to do it. I'm going to train you how to be a trainer and be a facilitator. Here's the data. Go do it in the way and then the language that works best to respect your community's needs. And it's been really exciting. So that is definitely something that's happening. We're seeing more health educators, nutritionists, dietitians, therapists, fitness coaches, other practitioners, some physicians, nurse practitioners are really enjoying this. And we have a quarterly coaching call, and the next call is in August, and it's gone from 4 people to 25 people. I mean, I've sold more courses than that, but who's the people who are really engaged are always a little bit different. We've had now in LA, somebody is doing their second boot camp. So one of my facilitators, I have information on menopause informed fitness. It's really a wonderful thing to be a part of. And so maybe my psychedelic use helped me come up with this. I don't know.
Exactly. You see more possibilities, and you connect more
Do.
dots,
Yeah.
and
Yeah.
because you're really looking yourself as a helper of the community, you're coming with this type of program. So where can our listener and viewer find you?
I mean, I'm pretty active on social media. My YouTube is sort of getting built out, but if you look for my name, and usually my tag is Ask Dr. Suzanne, AskDrSuzanne. I'm most active on Instagram right now, but I'm on Facebook as well. A little bit on TikTok, not really. And it's really been, and of course I, appear on television as well. So that's always interesting. But that's it. That's where I'm at. And I really encourage people to kind of follow along and see where the road goes, because it's been an interesting journey so far. And I think there's just so much information out there for us, but it's hard to know, Peggy, like who to trust on this stuff. So that's why it's so important for you to, create these experiences for people to learn more so
Yeah.
that they're not getting misinformed or
Exactly.
disinformed.
Education.
Yeah. Yeah.
I always say that, don't believe me. Mosaic theory, listen to 25 people, do your own research, and then come with a conclusion. But don't
Yeah.
listen 2 minute TikTok and
Right.
think
Right.
that you have the right answer. So,
Yeah.
Suzanne, thank you so much. Everyone who's listening or viewing, I really, really recommend the book Menopause Bootcamp. Very good book, really, really interesting and thought provoking. Whether you're going through that or will be going through that, or someone, a loved female in your life gonna go through that, I highly recommend. Everyone should know what's going on at that time of people's life, of women's life. So Suzanne, thank you very, very much, and wishing you a wonderful weekend.
Oh, Peggy, always so great to see you and talk to you. Thank you for the work that you do.
Thank you so much. Same here, and thank you for the information.